Advocating for public health policy. Healthcare-associated infections are one of the serious complications of healthcare. These types of infections are the fifth leading cause of death in acute care hospitals. Good morning, my name is Leslie Cantorna, and I am here to propose a policy that is known to healthcare workers. However, has not been implemented in policy. I have gathered some facts and statistics that I believe will be persuasive enough for you to consider my proposal. Here I have included a diagram of the areas that are missed during hand washing. If you don't already know, hand washing is the single most effective way to prevent the spread of infections. And with improper hand washing, patients and healthcare workers will be at risk of the spread of infections. In the diagram, the red are areas most frequently missed during hand washing. The blue are the areas less frequently missed during hand washing, and the tan colors are the areas not missed during hand washing. This is the reason why this health issue needs to be addressed because according to the CDC, improved hand hygiene is one of the most important steps we can take to avoid getting sick and to spread germs to others. I've listed 4 types of hand hygiene used in our facility. It is the responsibility of every staff to be required and know the differences of the type of hand hygienes and when and where it should be utilized. The basic hand washing is using soap and water. The antiseptic hand washing uses soap, water, and antiseptic agents. Alcohol-based rub is using hand sanitizer that includes alcohol, and it may only be used if hands are not visibly soiled. Surgical antiseptic uses an antiseptic and alcohol agent to wash hands before any surgical procedures. So, who is affected? 80% of infectious diseases are transmitted by touch. With that said, this policy will affect all healthcare professionals. Every person within a healthcare organization will be educated and trained on the proper technique of hand washing. So why is hand washing so important? Well, this policy will address all the health issues by reducing the number of germs being transferred, causing infection and diseases to patients and even to employees. And by enacting this policy, we are not only decreasing transmitted influenza, infections, and diseases, but we will also exceed our patient safety goal, which is also one of the Joint Commission of Health Organization's top goals. Now, let's evaluate the cost of this proposed policy. Our facility is a 120-bed hospital in which each room should have hand soap, towels, and sanitizers. Other departments, such as cardiology, physical therapy, emergency room, post-operational, kitchen, environmental services, dietitian, radiology, and so on and so forth should also carry supplies. Therefore, we are averaging out about $17,012 annual on supplies, not to mention educational votes, posters and flyers, and training staff proper technique. with a total of $27,012 yearly expenses. According to the reports from the CDC of staph infections within hospitals in the United States, the cost per survivor of a bloodstream infection was nearly $40,000, and that's on one patient. Now imagine if you times that by the number of patients who receive infections during our care, you would be looking at a bigger cost than $27,000 a year. So in my case, hand washing is a cost-effective strategy to reduce infections. So why shouldn't it be mandatory for every employee to practice this care? The lives affected by this. The lives of people who are affected by the health issue changes if this policy is enacted are the patients. And I quote, "The increased length of stay per patient will reduce Staphylococcus infection causing death to high-risk patients with poor immune system." End quote. Again, I'm quoting, "Risk factors and outcome of nosocomial infections have high morbidity rate relating to more infections in high-risk patients." End quote. So if you take a look at this chart, 70% nurses are washing their hands before and after patient contact. So what does this mean? What this means is that 30% nurses who are not washing their hands have a high chance of spreading infections to other patients. Now, take a look at the lab techs. 63% are washing their hands. I mean, these people are the people who deal with blood, urine, or specimens that are received from biopsies or other procedures. You would imagine that they should be washing their hands, right? Well, it goes along with other healthcare workers within the hospital who are not washing their hands. So that's a lot of people not washing their hands and spreading germs and infections and diseases. And other people are also um, at high risk for that, not just patients, staff, doctors, visitors. You know, there's a lot of people that visit hospitals who are at risk. And it only takes a second just to wash your hands, soap with water, or even sanitize, just a few seconds. Now, let's take a look at this chart. This was taken from Prince Albert Parkland Health Region. Their compliance rate seems to decrease in 2012 and early 2014. In November of 2014, it slowly increases. Well, my main goal is to have all these charts lined up evenly throughout the years. Why not be consistent at 90% or even 100%? If you vote for this policy, we would be at 100% compliance every year. We would be voted as the most cleanliness hospital, and maybe more patients would choose our hospital rather than other leading hospitals, which will also increase our revenue. So basically, it's a win-win situation. Wouldn't you agree? So let's talk about the benefits of this policy. What are the benefits? Well, let's take a look. It reduces infectious diseases. It reduces influenza outbreaks, reduces staph infections, and reduces diarrheal diseases by 47% and respiratory infections by 34%. Wow. That's really pretty amazing, don't you think? Just by washing your hands, it's like the cheapest thing that you can do in a hospital setting. So gaining the votes of the constituents should be based on Joint Commission's audit compliance for patient safety. the reduction of infections within regions, increasing productivity by avoiding employees from getting sick and calling in sick. And it also saves the hospital money by preventing the health issues rather than treating the infections. Wouldn't you agree? I think that if patients were being admitted and they're there for a different type of reason or health reason, and then they get an infection just by an employee not washing their hands, I think that it would cost the hospital more money to treat that infection or treat that disease. Yeah, well, there's things to think about. So basically, that covers my presentation, and I really hope that you would vote for this policy. These are the references that I've utilized in my presentation. I hope you agree, I hope you agreed, and I hope you enjoyed my presentation. You have a good day.